So, when they say that it feels like you're drinking out of a fire hydrant or a fire hose, they are like people who have said that to me are correct.
What's one thing that surprised you the most about med school?
I keep coming back to the environment because I really didn't expect that.
Hello, and welcome to the Med School Years podcast. I'm Dina.
And I'm Carlos, where we talk about everything you need to know about the medical school journey and residency.
We've both worked closely with applicants, advisors, and schools to understand the ins and outs of what it takes to get into med school. And now we're going beyond the admissions process.
And don't worry, this podcast isn't just about the boring stuff. We're also going to give you a behind the scenes look at the life of medical school students and residents.
We know that medical school can be overwhelming, but we're here to break it all down for you with expert tips, insider advice, and stories from people and students who've been there.
So whether you're starting the exploration process or just curious about what it takes to becoming a future physician, we got you covered.
Sit back, relax, and welcome to the Med School Years podcast. Hi, everyone, and welcome to another episode of the Med School Years podcast. I'm Dina, here with my colleague and co-host, Carlos, and we're super excited today. We will be interviewing Harshini, who just finished her M1 year at Cooper Medical School of Rowan University and will be starting M2 this August. So welcome. So excited to have you here today.
Thank you for having me, Diana and Carlos.
So exciting. I have a question for you to start off. You have a really interesting background. You got your bachelor's degree, dual bachelor's, right? BS in bio, BA in psychology at Stony Brook. And then you took a year and you completed an MBA at Stony Brook before entering med school, which is really unique. So talk to me a little bit about why you chose to pursue the MBA and how you feel like skills that you learned, like leadership skills, etc., have translated into your medical education.
Yes, so I was actually inspired by a friend of mine she was in the fast track MBA program at Stony Brook, which I was never aware of until I met her. In speaking to her, and then tying in what she said about experiences that I've had in the hospital, looking at, I guess, the overcapacity of hospitals, how there are patients who are placed in beds in the hallways, and in speaking to other healthcare workers, I learned that it's very important when I'm working in either a hospital setting or a private practice to have an administrative point of view, which is why I thought it'd be useful to get an MBA early on during my gap year. I feel like I would have done the same thing maybe when I was in residency, but I wanted to utilize the time that I had during my gap year. So that's why I decided to get an MBA. And we had a bunch of leadership classes that taught us how to get our point across to create a cohesive environment for everybody. And I feel like those skills are things that I've been able to utilize and tap on during our ALGs at Cooper. They're called ALGs. They're like case solving sessions with about 8 or 9 people. And so I feel like those skills have been useful in that setting. And I think they'll be useful in terms of rotations as well.
Thank you.
That's awesome. Thank you. It gives you, I think, a different perspective, right? When entering medicine, you having some at least concepts, knowledge of the things that you're going to experience in the clinical setting, even in medical school. I know that in the last couple of years, that has been a hot topic of like, what does it mean to provide healthcare, right? You're trained as a physician to provide patient care, but there's all these like threads and these unknowns within healthcare that I think students want to explore. So it's good that you bring that with you to the classroom. And I think that's potentially why they said, yeah, this is interesting, right? We want her as part of our class because she brings a different insight. I think the question for me is, why a dual BSBA? Like, what did you see in that as a potential springboard for your career in medicine? Like, what is that motivation there?
Yeah, so I started off as a BS in biology. That's how I got into Stony Brook. And then I added the BA in psych later. So my motivation for getting another degree in psychology was I was just interested in the classes that I was taking, like social psychology, for example, understanding the mechanisms behind the interactions and the connections that we form with people. That was also a springboard for me getting into psychology research and understanding adolescents, how they work, and I guess the anxiety that manifests in terms of like social interactions. I personally thought it was interesting, which is why I decided to get a BA in psychology as well. I feel like more than getting it from like a pre-med point of view, I decided to pursue it because I really liked the classes that I was taking and I just wanted to continue taking those classes.
Awesome. Thank you. Thank you. Are you a mental health interest area as you begin your career exploration as for residency? Is that an area of interest of yours?
Yeah, so I started advocating on a local level in like Stony Brook student orgs. So that'd be like reproductive health, justice, things like that. But then I didn't realize until I got into medical school that as medical students, we can advocate on a state and a federal level through organizations like AMSA. And so I went with them to the Future Physicians Conference in DC, where we spoke to our state legislatures about the Dr. Lorna Breen Act. How it works is trying to get mental health resources for healthcare providers and trying to reduce that stigma in terms of like residency or job applications.
Awesome.
Harshini, you mentioned your work with AMSA. I'd like for you to kind of explain what that organization is for anyone who doesn't know, but also the leadership behind it. When you were talking about your MBA, you talked about how a lot of those leadership skills translated. In looking at your involvement thus far at Cooper Rowan, you're a Global Health Scholars Program Director for AMSA, and you've taken on additional leadership roles like street medicine leader, internal medicine interest group leader. Talk to me about how that leadership capacity was cultivated. And for all the pre-meds out there who say to us, is leadership really important for my application? Please explain why it's important once you get to med school.
I'll start off with what one of my professors said. So I took a medical ethics class this past semester, and I learned from him the importance of cultivating your voice. I think it's very important to find early on what issues are you passionate about? How can you use your experiences and your skills to highlight that? And I feel that it's through leadership, through engagement that you can do that. And so that's what I'm trying to do with AMSA, is the American Medical Student Association. And one of my friends recommended that I join as a program director. And so I've been able to meet with other global health and public health experts and learn from them. And then whatever opportunities that AMSA brings my way, I've been trying to get engaged through that. I feel that my MBA helped me further develop my communication skills. I've been a little bit on the shy side, to be honest, and I feel that getting my MBA has helped me be more confident in what I have to say, not overthinking. I feel it's very easy to do that, and especially in medical school, the imposter syndrome, that's very real. Getting my MBA was a way for me to overcome that, for me to build my public speaking skills. And also, I feel that for me, it was part of my real world experience. So, some applicants may have had job experience. Well, that was my real world experience because I was interacting with professionals from different fields, not just students. And I think that also getting to connect with different people, maybe who aren't in the school setting, I think that was also helpful for me to integrate into the medical school environment as well.
Thank you.
Okay. Thank you for sharing that. I mean, it clearly you identified these deficiencies right within yourself, and you said, "I need to do these things to improve as I move forward in my career." I wanted to take a shift a little bit because you're talking a lot about doing things in medical school. And the question I like to ask all medical students is medical school everything you dreamed of? Or is it something totally different that you're just like, I didn't even know what I was getting myself into?
So, when they say that it feels like you're drinking out of a fire hydrant or a fire hose, they are like people who have said that to me are correct. Um, I think it was definitely an adjustment in the beginning in terms of like workload. I am an out of state student, and Cooper is a lot of people there are from New Jersey, and so that was also an adjustment on its own. I love where I am. I love the school. I love the support system that they're trying to integrate us into. So it's not you're not going to the deep end by yourself. I love that I have the support that I need, and I had that before I started to gain my footing. Cooper, you have access to learning specialists. You have advisory support, career support. Yeah, I'm very happy with the place that I'm in. I think Cooper's doing a great job in integrating us into opportunities. There's something to do, like if you're interested in like specific career path, or that'd be like hospitalists or like leadership, or you want to do more hospital admin. There's always orgs that you can get involved in, and I really like that about Cooper. And I think Cooper's doing a great job, and I'm happy to be there.
That's awesome to hear. I remember you and I worked a little bit together last cycle. When it came down for you to make a decision, I connected you with a former student of mine who is at Cooper. I don't know if you remember
Mhm.
that.
I do, yeah.
Uh, yeah. So tell me about how important that was for you to kind of network and speak to somebody who's already a student there who could
Mhm.
share their experience and how important it was in making your decision.
Yeah, I think it was important. The student that I spoke to, he helped me identify what were my priorities, what was I looking for in a medical school, how was that aligned with what I saw my career trajectory to be. And for me, being involved in service learning was super important. And that's why I was drawn to Cooper, because there's so many different organizations and nonprofits that we can get involved in that are targeting each aspect of the community. Like there's food access, language barriers, transportation, medical care, the organization involved in street med that's targeting care for homeless individuals, where we go and meet them where they are, and further reducing the stigma that they may experience when maybe they come to the emergency department or an addiction clinic, getting rid of any fear that they may have. I think in speaking to that student, I got to learn more about the opportunities that were there, because you're not going to get the complete picture in looking at the school's website. So I think it's important to have that student's insight, as well as how they adapted. Would we fit there? And I think support was another reason why I chose Cooper, because I want that support, the guidance, for the 4 years that I'm there. And so those were the reasons why I chose Cooper. And I think I got a better understanding in speaking to that student. I think it's very important.
Thank you.
Yeah. Thank you for sharing that. I think I've had a couple conversations with folks in the last couple of weeks. I mean, peak season for applications for medicine of how do you create a school list, right? And I think you
Mhm.
go to traditionally, or the easiest thing is MCAT, GPA, and then like prestige, right? Name that comes with the institution. But
Mhm.
as you pointed out, there's a lot more, right? It's the personal desires, the things that you need to thrive in the environment. So I appreciate you highlighting that because I can convey that as much as I can. And I think Dina does the same by hearing it from a medical student, understanding how these other things are important. And the selection of what schools you're submitting an application to is also important. So thank
Yeah.
you for sharing. You talked a lot about support system, and I think you're saying they Cooper provides a lot. That was one of the reasons that you went to Cooper. And then you talked about career exploration, and I would
Yeah.
imagine that's also part of the support system. What is that looking for you in terms of career exploration? So you're coming into medical school, you're going to be a doctor, right? Now you have to figure out and decide what kind of doctor you want. Where are you at? Or what are the support services that Cooper offers you to help identify that path for you?
Yeah, so at Cooper, we have, like you said, a career exploration system where we have providers for each subspecialty. So there are doctors like an anesthesia, for example. We have IM, like two IM doctors. So for different specialties, you can go and talk to them, get their insight. They can talk to you about what your goals are, maybe suggest some other opportunities to get involved, and then go through your portfolio and how it's looking, and whether you need to get involved in like research for the more competitive specialties, for example. So there is that network there for us. we also have our own personal advisors. So we have something called advisory colleges. It's sort of like Hogwarts, where there's like 4 different colleges. And so we're matched up with a big SIB or like an M2, and we're matched with an advisor. And so I've gone to my advisor whenever I needed like advice in terms of like transitioning from like block to block. How do I do that? Or I met with my advisor just a couple of months ago to discuss my plans for the summer and how that would look like. Talking to him about away rotations as well, because I'd like to match in the Northeast. So discussing that early on. So I think grateful that we have different people that we can go to. I'm always worried about burdening people and like asking too many questions, but Cooper doesn't make it seem like that. They're always happy to help. They welcome any questions with open arms.
So what will you be doing for the summer? You mentioned
Mhm.
that you discussed with an advisor, options for the summer. What does summer after M1 look like?
Yeah, so I will be doing some remote research projects that are carrying over from Cooper Hospital. Chart review, I'm also working on an IRB for a project that's analyzing chronic data from a chronic disease treatment program for underserved Tina women in South Jersey. So I'll be working on those 2 projects and writing a case report as well. As long as my fellow classmates, we're all doing similar research projects, chart reviews, case reports. We have our own original projects, either working on IRB or working on data collection for that project. And if you're interested in wet lab research, you can also do that as well. I personally was not. So I chose to go down this route. I will also be previewing my cardio block as well, just so I am not out of touch when I go back to med school 2 months later.
Thank you. How did your previous research basically prepare you for research in medical school? Because you've already been published during your M1 year, correct?
Yeah,
Which is
I have.
which is amazing. Congrats on that. For the students out there again who say how important is research, how important is research to get accepted to med school and how important is research in med school? Can you shed some light on that and how prepared you were entering med school to dive into research and get a publication?
So in college, I started off my research journey by cold emailing. So basically, reviewing journals that were published by the PI that I wanted to work with, going through the lab website, and then sending them an email and explaining why I was interested. And so this was something that my high school mentor taught me, and something that I continue to do in college. And that's how I got one of the first research opportunities that I got at Albert Einstein. And also at Stony Brook, there were emails that were sent out about like psychology research opportunities. I kept checking my email and I was responsive. And so, yeah, so I think it's important to go for it, to cold email and to not be afraid of taking that step, and to also not be discouraged if you do get rejected your first time, because it has happened to me. Some labs might look for people with more experience, so just keep trying. I feel that me in college, going through these research opportunities and reading journals has helped me in medical school as well, because that's something that you will be expected to do and to build your skills. Because in the future, what I've learned is we will need to critically analyze literature and to make treatment decisions based on what we're reading. Yeah, that's something that I would recommend that undergrads do.
Thank you for sharing that. I mean, clearly it's going to be an important part of your journey, right, into becoming a physician. What other things are you doing now outside of research, right, this summer to prepare as you go down the path of becoming a second year, but then thinking about the long run as a resident? Like, what other activities besides research are you doing?
Yeah, so I am also thinking about doing this class called Medicine and Society. It's run by a primary care and family medicine doc at Albert Einstein, and basically teaches you about the evolution of medicine, about racism, and like other public health topics. And we get to have discussions about it, as well as there's a learning component. And I thought it would be useful for me to just to gain that knowledge because I'd like to in the future be involved in like social justice efforts or continue to provide care to the underserved. And so that's another opportunity that I thought was cool. And the class is actually going to start in exactly 2 weeks. Outside of that, I would say watching Force and Beyond videos whenever I can. Just making sure that I'm still, like in touch with the material, but not like pressuring myself too much because I still have time for that. And another thing is I'd like to continue exploring like shadowing opportunities. I think that's very important to you, like what I was saying before, to utilize the time that you have. That's something that I'll try to do as well to continue to narrow down my search to a couple of specialties that I'm interested in so that when M2 comes my way, I'll be able to continue further narrowing my search with the limited time that I have.
Awesome. Thank you for sharing. Thank
Mhm.
you.
Harshini, you have this theme of, it seems, of pushing yourself outside your comfort zone a little bit,
Mhm.
just mentioning a few different things like cold emailing professors and just putting yourself out there, right? And I think that that's really important, especially since you mentioned before that you tend to be shy. Just even being interviewed for our podcast today is pushing yourself outside of your comfort zone. Tell me how during interview season, right? Any tactics that you use to overcome that shyness or to kind of push yourself outside of the zone of comfort?
Yeah, I think what helped for me was going through questions that I thought may be asked and noting down all the points that I wanted to hit because I knew that that initial nervousness would be there. And so I wanted
Mhm.
to make sure that I was approaching the interview with a solid database of information. And then from there, telling myself that I was invited for a reason. They want to speak with me because they saw some things on my application that they liked. Continuing to tell myself that, I think, lessened the anxiety a little bit. I liked how, for some interviews, they asked personal questions like hobbies, or if there was a personal story that I told, there would be follow up questions. And I feel that that continued to ease my anxiety a little more because I was able to connect more deeply with the interviewer. I think that came across. So overall, you're there for a reason. So
Yeah.
continuing to remember that I think would be key.
And just be human, right? I think a lot
Yeah,
of students
yeah.
forget that in an interview, that you are
Mhm.
selected for a reason. They
Yes.
saw something in your application and in you as a future medical student, and just be human. Have a
Yeah.
conversation, be yourself.
So I'm curious to know, now that you've been in medical school for a year, you said most of the students are from sort of, there's a mix of out of state and state.
Mhm.
What is the composition of the class? Like, what are you learning from your friends, colleagues? Like, what do they bring to the classroom that you were like, this is unexpected. I didn't never thought about.
Yeah, so there are a couple of students who are actually they've been in the military or this is like a career change for them. And so I thought it was very interesting to learn more about their professional backgrounds, why they made the switch. I've learned from them in terms of the questions they ask, like, oh, I didn't think about that, the perspectives they bring. In the medical ethics class that I took, we had discussion boards and just seeing how they wrote, what ideas they put on paper, I thought was also interesting too, because I don't think everything comes across on conversation. And so when you're asked these questions that are probing and you see what other people have to say, I thought that was pretty interesting as well. I would say in my class, a lot of people are around my age. So I think even if I was out of state, I think it was easier to connect with them. Yeah, overall, I would say they have taught me to continue speaking up and to share my perspectives because that's the environment that they have created, that there's no like stupid question that I'll ask. Their affirmation and their encouragement is something that has helped me grow as a person and is something that I have continued to reciprocate. And I think our school is very big on being a team player as well as using each other to grow. So I would say that's how I've learned from my colleagues.
Thank you for sharing that. I
Mhm.
appreciate that. It's you don't know, I think, that the diversity and what everybody brings until you start to meet and make connections. So it's
Mhm.
amazing that you were able to sort of witness this even from classroom interaction, right? Not direct
Yeah,
asking questions, but just the thoughts that everybody brings and their perspective. So it's
yeah.
amazing just to be able to have you share that. Thank you.
A lot of premeds don't understand that, right? We try to get that across as much as
Mhm.
possible in advising that, the pool is a pretty vast pool of different ages
Yeah.
and experiences, right? There's an art to forming a class, whether it's undergrad class or a med school class, and putting this pool of people together who can, learn from one another. And it sounds like you're really doing that. So that's fantastic. What's one thing that surprised you the most about med school?
I keep coming back to the environment because I really didn't expect that we'd all be this much like supportive of each other. I think in Stony Brook, it was a big pool of students. And so there were at times I did feel lost, except for like the 3 or 4 people that like I was friends with. It was such a big school that sometimes it felt like I was going through this journey by myself. And so I appreciate the cohesiveness that our class has. I really was not expecting that. And yeah, I would say that's one of the things I was surprised about.
Thank you.
Yeah. What do you think are some of the, I wouldn't say challenges, but some of the things that somebody, again, right, that's coming into medicine that they should expect or that they don't know what to expect, but that now you having been in medicine for a year or in medical school for a year, that you would say, this is what I learned. I'm just want to share this with you. Or some of the things that you just don't see, right? Like you made a comment about it's not on the website, but these are the things that you should keep in mind that maybe health students or just medical students are not aware. What do you think some of those things are that you can share from your perspective?
For me, I think a big challenge was time management, balancing everything that was going on in my life. And to be honest, I still don't think I have it down exactly. But there's one thing that an M2 told me: you're going to do the best that you can, and you won't know every single detail that you learn, but that's okay. I've tried to take that approach to learn whatever I could in a framework that made sense for me. For example, like breaking things down in terms of like epidemiology, like pathophys, clinical presentation in a framework that was concise and that I could fit into like illness scripts or like bites of information that I could pull up when I saw a patient with a similar presentation. It's very different, coming from undergrad where we're expected to read these slides and take multiple choice questions versus now. So I think that was a big challenge for me. And I would encourage people to not beat themselves up if they don't recognize a specific detail in a question. That's okay because at the end of the day, as long as you get the broader picture and you can recognize it when it presents in patients, I think that's more important.
What are you thinking of for specialty? I know it's still far away, but you've had a lot of exposure so far between undergrad and M1. And what are you drawn to?
I am drawn to internal medicine. I really like the variety that it has to offer, and especially thinking about maybe going down like the hospitalist route, that sort of like temporary primary care medium, because I still like to see the acuity side of things, but also have that connection with patients. So that's something that I'm thinking about. Specializing is a possibility, but for now, I really like how you can seeing all patient presentations in like cardio or like GI, for example. So yeah, that's what I'm thinking about for now, but we'll see.
So you made a comment, specialization. What does that
Mhm.
mean for the people that don't understand? Can you explain that?
Yeah, so after you do your internal medicine residency, you'll have the opportunity to pursue a fellowship. It's called like subspecializing. So you could do a fellowship in cardio or GI or endocrinology, room. You decide you want to subspecialize. I think it starts from maybe like shadowing, or if you're sitting through a lecture and you decide, oh, this is a topic that I'm interested in. What students have done is they've gone up to the professor and they've chatted with them. I think that would be a good route to explore, specialties when you're in med school.
Thank you for sharing that.
Mhm.
Did you have a preconceived idea going into med school? Like, because so many students do. And I think it's what, 70% change their minds at the end of the road. Like, did you walk into the doors of med school and you're like, I'm going to be a cardiologist, or I want to be a dermatologist, and then things shifted for you? Or did you walk in open-minded? And how important was it to remain open-minded?
So I walked in thinking family med or internal med or like primary care, maybe outpatient, and that was a big part of my personal statement and also the activities that I chose. But I will say, I think it is important to be open minded because if you are restricted, you don't know the value of learning from opportunities, I think will sort of be diminished if you're closed minded. So I think it's important to approach things with an open mind because you don't know whether you're going to like it, like a particular opportunity or not. Having said that, it's also a good idea to know what you like and what you don't like. It doesn't have to be like a specialty. If you know the values, what values do you have and what are your goals and how you see your long-term trajectory in terms of like work-life balance, I think that's important. So like having that idea and then building from there, I think would be like a good medium.
I see that you are involved in internal medicine interest group, right? And I think you are a leader in that group. How is that where your interest in internal medicine came from? Like you decided to join a student org, or was it something else? What triggered that?
So for me, we have in Cooper, we have this week called Wow Week. And basically, M1s early on in October, we get the opportunity to rotate in the hospital. And so during my IM rotation, I loved my IM rotation. I think that was one of my favorite shifts. And that I want to say like passion or like interest sparked from. And then I started getting involved in like the internal medicine interest group. I realized they had opportunity to shadow. And so I started shadowing like subspecialties and realizing that, okay, maybe some specialties aren't for me. It's not what I'm interested in. I would say it started from an opportunity that my school had, and then I started actively looking for more organizations to be involved in, or like reaching out to doctors and seeing if I could shadow them. And we also have a hospitalist program in our school where you're paired with a hospitalist and you get to talk to them about their life as an attending and then when they teach how that works. I also learned about the hospitalist track within IM programs, and there's also like a med ed track. So I just like the variety that IM has to offer. There's so many different directions that you can go in terms of your career. So yeah.
For students watching who may not know what a hospitalist is or hospitalist track is, can you explain that in depth a little bit?
Yeah, so a hospitalist is basically like your primary care physician at the hospital. So the way that I was explained this concept was primary care doctors, they'd see their patients from like 9 to 5, and then if their patients were in the hospital, then they'd come to the hospital later that evening to check on them. But obviously, that's not going to be feasible in the long term, right? In terms of like work-life balance and juggling all these responsibilities, which is why the hospitalist profession was created sort of as like a temporary primary care physician who's there to fill that gap.
And housed at the hospital, not
Yes,
a
and housed at the
private
hospital.
office.
No, yeah. So they have contracts they would sign. So X number of weeks working at this hospital, and then if you're teaching, you'd get X number of weeks built into your contract. So that's how my mentor explained it to me.
Thank you for that explanation.
Yeah, thank you for providing an insight for those that don't know how the hospitalists function. I have a question about sort of, again, it seems like you have a desire, again, you've explained internal medicine, but I want to take a step back and I want you to recall your first clinical patient interaction as a medical student. I think as a pre-health student, sometimes you're limited by what you can do. Can you tell us a little bit about what that was like, right? You're now a medical student. Like, I think you're even inching closer to becoming a full-fledged physician to eventually having your own patients. But describe that moment. Like, what was it like for you as a medical student seeing patients for the first time?
Yeah, it was super exciting. So we started seeing patients, I want to say in like September. And so I started seeing patients at our free clinic, and that's when I realized, okay, this is real, I'm here, I'm talking to the patient, I'm interviewing them, and I'm discussing all of these like illness scripts and like treatment plans for my patient. I think that was like a shift. Like, oh, I'm going from reviewing charts, getting like the basic history as an MA to actually diving deep into my patient's history and having the responsibility to ask other questions about like social determinants of health. That was ingrained in our school as well because a lot of these patients are uninsured, underserved. And so I have enjoyed my experience thus far. And that first experience, I was scared because you're going in and you 1 month in, you don't have much training and like how to garner a proper history. But with my team's help, I was able to make it through. And yeah, it's nice that the patient that I saw like early on, they some of them have continued to come back to us. So it's nice to see like that longitudinal care as well.
It sounds awesome. Again, it's a different perspective, a different view when you're a medical student than when you're a pre-health student. So
Yeah,
thank you
it
for
is.
sharing your personal story.
My last question for you, Harshini, is what have you done for fun during M1? How have you maintained your wellness, and how have you kind of put school aside and enjoyed yourself with some friends, new friends?
So I have enjoyed hanging out with friends, whether that be like exploring Philly. That's Philly is like right across the bridge from Camden, or I'm personally like a suburbs girl, so we've also explored like Cherry Hill or like Hollingswood. I would say whenever we have time, we've planned like get-togethers. Or our school is also really good about organizing get-togethers. Our student government plays a big role in that. I would say my family as well. So I've gotten the opportunity to come back home more often. I would say because I'm in a drivable distance away from my family. It's about like two and a half
That's
to three
nice.
hours. So like not too bad. So I'm very fortunate that I can see them in person. I would say that's how I've maintained my wellness. Yeah, I would say also our small group, the ALGs that I was talking to you guys about, we've also become more like a family unit. And so I would say they've also been a big part of my wellness. So thank you. And making sure I'm not going crazy during this time.
Yeah. Yeah. That's important, definitely, as a medical student. I think you talked about it, time management, the balance, and focusing on your wellness, right? Without you being well, you won't do good in academics and in clinics. So it's always good for you to take that moment for yourself. As we wrap up your time with you, I always like to end with what is one nugget of recommendation, inspiration, motivation, knowledge that you would give any pre-health student or any medical student, right? As they enter this profession now that you've been in medical school for a year? What's a one takeaway that you would share with anybody?
I would say don't stress and choose your opportunities wisely. Um,
That's
you
smart.
can't say yes to everything, and I've had a habit of doing this and spreading myself thin, and that's something that I'm still working on. So I would say whatever opportunities come your way, think about what you're going to gain from this opportunity and how will it be how what skills will you take away from it, how will it be useful for your future. What I've noticed is during applications, they very much like to see like a theme with your application. So for me, it was more like primary care, social justice, social terms of health, like combating barriers to care. And so if you are a heavy research person trying to get more like research opportunities, or if interested in service, becoming more involved in your community, maybe exploring like global health opportunities. So that's one nugget that I would give, making sure that you're choosing opportunities that you would gain valuable skills from, and that you're going to remember down the road when you're a medical student.
Well, thank you for that. Thank you for sharing that. I think it's a great takeaway, even for us, right? Don't stress, and really,
Yeah.
what is the value that it adds to your career and your future goals? So, thank you, Harshini, for joining us today. We appreciate your insights. We wish you luck. We
Thank
can't wait
you.
to see what
Well,
happens in the
Thank
future.
you.
Come back and let us know how that progress is going along, how it's moving. Okay.
Sure, I'd love
All
thank
to.
right.
you.
Thank you for having me.
Oh,
Thank you
you're
so much.
welcome. Thank you.